Mm. Good afternoon, sir. Welcome for this meet.
Thank you, Vishnupriya. Yeah. So, where can I upload my
Sir,
slides?
good afternoon.
Good afternoon, madam. Uh,
She's a faculty member, sir.
oh, sure. Thank you.
Dr.
Um,
N.M. Mekla.
yeah, even Gauri
Yes,
said
sir.
yes. You have to give me the rights for uploading the slides, right?
Wait, sir. I will ask my technical team to permit
Yeah,
you, sir.
yeah.
Sir, is it possible now to upload your data, sir?
Where I should upload? That is what uh,
Sir, the best way you can share your screen note, sir.
that is what I am just looking at. That is, you have not given me permission to share the screen, I
Wait,
believe.
sir.
Yeah.
I will do it.
Yes.
Sir, please check that we have given permission, sir.
Wait. Yes.
So for your kind information, we have
Yeah.
nearly 90 students for this webinar, sir, and rest of
Okay.
the people are going to join in the YouTube stream, sir.
Okay.
So please give me your 3 to 5 minutes time so that all the students can join.
Yeah. Can you see my slides now?
Yeah, yeah, yeah. It's visible, sir.
Is visible. Okay.
Yes, sir.
Sure.
ஆல்ரெடி ஆல்ரெடி இருக்கீங்க கால் வருது அதுதான் அந்த கனெக்ட் ஆகும்.
பிறகு பேசுறப்பா.
Dr. Harish, are you here?
Yep.
Sir, shall we start the session, sir?
Sure, definitely.
Okay. Warm good morning to one and all gathered for this international webinar in this digital platform. This is Vishnu Priya, Dr. R. Vishnu Priya, Assistant Professor of Commerce, Saurashtra College, Madurai. I'm greatly happy to meet you all in this digital one for this wonderful session. Today we are going to have a common topic, I think so, but still This topic is a never ending one in this current scenario. The topic what we are going to discuss in the session is COVID-19 commoner perception on past, present and future. So I will call our HOD, Dr. J.D. Duresami, to welcome the gathering. Sir, please.
Good morning, everyone. Good morning to everyone.
Good morning, sir.
Good morning, sir.
Good morning, sir. It is a great pleasure in proposing a welcome address. I welcome our college secretary and correspondents through Dr. Kumaresh and the managing committee members for this wonderful seminar. I extend my welcome to our college principal, Professor N.H. Saravanan. My heartful welcome to our chairperson of this seminar, Dr. Harish C. Chandramoorthy. I welcome the faculties of Commerce Department and other department staff and technical persons. Last but not least, my special welcome to the student gathered here to enrich their knowledge. I once again welcome each and every gathered here. Thank you, madam.
Thank you, sir. Thank you for your wonderful introduction. Now I call my friend Dr. N.M. Mekla to introduce our chief guest.
A very warm good afternoon to you all. I, Dr. N.M. Mekla, Assistant Professor of Commerce, taking this privilege and opportunity, as well as the immense pleasure to introduce today's eminent and honorable chief guest of this international webinar, Dr. Harish C. Chandramoorthy, Vice Chairman, Stem Cells and Regenerative Medicine Unit, Associate Professor, Department of Microbiology and Clinical Parasitology, Consultant Molecular Virologist, ABBA Maternity and Child Hospital, College of Medicine, King Khalid University, Saudi Arabia. See, I feel very proud to introduce such an eminent resource person of today's webinar. See, he was born in the year 1973, such a young and energetic personality. Really, I feel very proud, sir. See, in the year 1994, he has done, that is 91 to 94, he has done his undergraduation in microbiology, and in the year 94-95, he has completed, he has done his postgraduate diploma in medical laboratory technology and electrocardiogram technology. Sir was a topper. He stood first in the college. Sir has done his master degree in biochemistry, actually undergraduation in microbiology and post-graduation in biochemistry. So he has selected the different discipline in the year 95-97. And say in the year 2000 to 2005, he was undergoing his PhD doctoral degree in biomedical sciences virology in Tamil Nadu MGR Medical University, Chennai. In the year 2005, He was assistant director and technical head LifeCell. In the year 2007, he became head research and development biogenetic life science India. Sir showed his passion towards the postdoctoral, which he has done in USA and got awarded in the year 2012. In the year 2013, Sir has been appointed as an assistant professor and vice chairman STU KKU KSA. Then 2014, he has been designated coordinator from January 2013 to till date. Sir is the vice chairman, stem cells and regenerative medicine unit, College of Medicine, King Khalid University, Saudi Arabia. Currently headed and established the stem cell, his own stem cell, and in the past 7 years, he has directly or indirectly collaborated in research with other reputed institutions across fraternities. See, he has published more than 25 publications in ISI journals, secure small and big grants from national as well as international level funding agencies. Apart from this, he has written number of articles, more than 63 articles he has published. See, he is also guiding the medical students and he is acting as a visiting professor, see, Lenora Institute of Dental Sciences, Andhra Pradesh, Vijayawada, India. Apart from that, Sir is giving training to postgraduate students in cell culture and like that he is doing number of activities. So Sir is serving as supervisor to troubleshoot protocols. Sir is the member in Indian Chemical Society, Indian Association Medical Microbiology, Stem Cell Forum of India, International Association of Medical and Pharmaceutical Virologists, and Saudi Society for Medical Education. Sir is acting as associate editor and academic editor in international journals as well as forums. Journal of Transplantation and Plastic Surgery. So, Sir has been invited as a guest speaker for more than 23 medical centers. So we have to feel very proud to have such an eminent professor. Sir, our chief guest, right? So Sir didn't leave anything. See, he's a master in all the fields. So he has taken care of animals like mice, goose, and chicken, etc. See, Sir is the all-rounder and has computer knowledge, skill in networking, net surfing, CRMs, and ARMs. Sir has received many gold medals, silver medals in various fields. Till date, he has been invited as a visiting faculty in various universities and colleges. There are numbers to say about our chief guest, but due to time constraint, I'm not able to complete the entire thing. Sir has given so many things, but I'm not able to complete the entire thing, but still I'm giving a little, right? We are lucky enough to have such an eminent and elegant personality to this international webinar. Thank you. Thank you.
Thank you, ma'am. Thank you for your very, very detailed introduction part. Sir, Dr. Harish,
Yeah.
I'm very astonished to hear your biodata, sir. Happy to see you, sir, in this webinar. Okay, now I call upon Dr. Harish to deliver a lecture to the gathering. Welcome, sir.
Sure. Thank you, Mekala and Vishnupriya. It was very kind of you to introduce me with a very huge biodata of mine. But anyway, thank you very much. Let me now go to the screen and just check whether the screen is available for you. Is the screen is visible? My voice is audible?
Yes, sir. Audible, sir. Your screen is also visible.
Yeah. Okay. Today, This is like a few of my platforms. Welcome all the managing people and the faculties of the Commerce Department and cross fraternities. It is my pleasure to be with you. And whenever there is a call from the student side or from the educational side, I never hesitate. Um, Today what we are going to see in the next 40 minutes or 45 minutes or so is a common perception, like what a commoner thinks about the past, present and the future of COVID-19. Are these messages, are the informations which we are getting through the Google, the messages which we are getting through the newspapers, gossiping, is it right? What is our understanding as a commoner? No need for a guy to understand COVID-19, to be a highly educated or to be a scientific guy or to practice medicine, nothing such sort. And common educated individual has to have a basic knowledge of what has to be understood from the entire arena of events which has occurred from 2019 to current date 2021. So that is what we are going to see, and maximally I will try to take it in a very smooth and a very interesting way, though this is like mostly like many of the things which you might be knowing, but still whether it is right or wrong and what are the questions which you have and it has been asked in various platforms for us is all depending upon the understanding, the nature we look into this subject. So in the next 45 minutes, 40 to 45 minutes, we will just see what is the current understanding, what was previous understanding, and what is going to be the future of COVID-19 in at least in India. The first, usually, it is always good that I acknowledge all my peers as well as the scientific work from where I have taken the reference materials. So I acknowledge them. And the disclaimer which I usually use to put is like, we are presenting the scientific content. It is your perception, like how you take it and how you practice it. So the decision is left to you. As an educated mass, you need to understand what is right, what has to be done, and what is good. And that cannot be imparted, but that can be only advised. I hope this slide is very clear, though it has a lot of Google searches. I mean to say that before 2019, when we are going to search about Jesus Christ or Modi, it was the highest number of search which came out. But currently, after 2019, if you just type coronavirus,
Sir,
it's about,
sir, sorry to interrupt you, sir.
yeah.
Your slide is not visible to us, sir. Only a screen is visible.
Oh, slide is not visible.
Yeah,
This is visible
just the plain screen is visible to us, sir.
now?
No, sir.
Oh, wait. Let me stop share and like let me share it again.
Okay, okay.
Are you able to see now? See my screen?
Yes, sir. It's clearly visible now, sir.
Okay. So acknowledgement and disclaimer I have put. And can you see this now?
Yes, sir.
Okay. Now, when you search, like informations are lot. When you search in the Google about coronavirus in 0.98 seconds, you are going to see about like 1, 5, 200, like 200 lakhs materials which can come out for coronavirus, COVID-19, COVID prevention and COVID treatment. You can see this many number of search can come. That means that the Google has this much number of data in it. But and it is higher than Jesus Christ or Modi. If you search, say Modi is around like around 20 years, he is there in the scenario. Jesus Christ is there for more than maybe from the internet, from the time of the internet, the search engines, the search about Jesus is there. So when you just look at into all these famous figures, this coronavirus has overseeded or superseded with information about it. What does this information relay or like really have? This information might be correct, this information might be wrong. We don't know. No one is there to check the Google that whether all the informations which are said in the Google or in other search engines are right or wrong. No one is there to check all these things. So there are so many informations available on coronaviruses. What has to be taken by us to understand or what is correct is the question, next question which comes. That is the commoner's problem. Anything you say about a medicine or say about a disease, it has been a practice now to just take a a smartphone and look into the Google about the information. But we will not be knowing that this information is right or fact checked. Nothing is known about it. So there are certain sites, trusted sites or trustworthy sites where we have to take up the informations, and that is a very small proportion of the entire search. So in order to show you the magnitude that like this many amount of information is available in the net, we should not be misleaded or we should not be misguided, and that is the reason for today's talk. And it is a common talk where anyone can understand and anyone can join. Now the past is, the first wave started in early March 2020 and it ended in August 2020. The second wave in March 2021, approximately it is till now in July 2021. The third wave is supposed to be starting at September or October 2021, and we don't know or how many days or how many months it is going to go. Variants found in India are Delta and Kappa. These are the variants which are found in India. So let us now assume or let us now know the data that this is the prime information where we need to know whether it is first wave, second wave, and when is the third wave is going to come. And in the second part of the cartoon, you will be seeing that there are a lot of informations which is available in the net, and we don't know. We are just bombarded with information. We don't know are we rightly informed or not. With all these information, do we know that is it right or wrong? We might be not knowing. The past, to know the past, the coronavirus or COVID-19 was first detected in China. Currently, the present scenario is it is seen in more than 100 countries. So coronavirus is present in more than 100 countries across geography, whether it is a mountain terrain or tropical or subtropical or a temperate region, it doesn't matter. It is seen in more than 100 countries. Future, what is tomorrow? Persistence. The virus is persisting. The virus is there. We do not know whether it will be solved or not. But to stop the virus or stop the pandemic, it is in our hands. Literally, it is in your hands. It is in each of our individual hands. So this is the information which I am going to give for about the future, that is about tomorrow. But let us see what was initially, just to know a story. Let us see what is past, let us see what is present, and let us see what is future. Coming back to the background, this is a very simple background. This is belongs like us, like all we have a family. Coronavirus has a family which is called as Coronaviridae. And again, in the family, you will be having many subfamilies. Likewise, Coronaviridae is the subfamily. There are alpha, beta, gamma, delta. They are the brothers. Brother viruses are there, in which this COVID-19 is caused by one of the brother called as beta coronavirus. Now, there is a question coming. There is clearly now there are iota, delta, kappa. These are some of the variants which are newly named and they belong to beta coronavirus for the sake of understanding. But in reality, the subfamily itself has alpha, beta, gamma, and delta, whereas beta coronavirus is the current coronavirus which is causing this pandemic. Many examples are there, and it is not true that coronavirus is very new to the world. The first report on coronavirus infection was early in 1970s. It has been reported in 1970s. This virus has been there for thousands of years with humanity. So this is not a new virus. But the current strain, so what we call as SARS-CoV-2, is a questionable strain, which is not, whether it has been naturally evolved or it has been artificially made in the laboratory is the current question. But coronavirus as such is a very old virus, and the existence of the virus has been well known. Beta coronaviruses are highly infectious, and initially in India in 2003 we saw SARS-CoV. This is SARS-CoV was seen in 2003. In 2007 and 9 we saw Middle East coronavirus we call MERS-CoV. These are all the older counterparts of the current SARS-CoV-2. And this is about an electron microscope. This is how in a transmission electron microscope the virus looks. There is a myth that coronavirus is not a virus and there is nothing called coronavirus, and no one has seen the virus. It is not so. Coronavirus is really a virus, and this is an electron microscopic picture of coronavirus, how it looks. It has a red color crown on it, and that is why it is called as coronavirus. And secondly, this is a scanning electron microscopy picture where you can see the magenta colored particles are the viruses which are there adhering to the human cells. So evidence, very clear-cut scientific evidence is there that there is the existence of coronavirus. So if anyone says that there is no coronavirus or this is the work of British agent or a US agent, it is not true. Really, there is a coronavirus which could cause disease. Coming back to the past, as we know that COVID-19, what does COVID-19 means? It is nothing but it is called as coronavirus disease 2019. Because it was first identified in 2019 and it was caused by coronavirus, it is called as coronavirus disease 2019. In 31st December 2019, a pneumonia case, a cluster of pneumonia case in Wuhan, China, first confirmed the existence of this virus. Then SARS-CoV-2 was named severe acute respiratory syndrome coronavirus 2 was named after its isolation in Wuhan in 7th January 2020. There had been very much previous outbreaks with coronavirus, especially as I said in 2003 in India and in Middle East in 2007 to 2008 there was a Middle East things. Before that also in 1970s and 80s there had been coronavirus outbreaks very well. Let us leave about the biology of coronavirus, which may not be useful for you, but you have to know that it is a virus. It is a simple virus. Coronavirus enters into the human cells through angiotensin converting enzyme 2 receptor. There is a receptor called as ACE2, and this is the gateway for the coronavirus to enter into the cells. And usually this coronavirus is harbored by civettes. Civettes means it is in Tamil, it is called as Punugu Punai, which means that this type of cats are nocturnal in nature. They come in night times. This is the cats which harbors the SARS-CoV virus. And Middle East respiratory viruses were harbored by camels, usually those camels which are reared for race. So this is the brief history of these viruses. Currently, the SARS-CoV-2, we don't know whether it is a natural virus or an artificial viruses. Many people have different theories, but currently it may be known that this virus might have been a mutation which could have been caused in a laboratory, and then it could have seeped into the market bats and it would have spread to the humans. This is what the current theory is there. So we don't know exactly that whether it is an artificial virus or a natural virus, but there can be chances that it is an artificially mutated virus in the laboratory, and there is a very strong evidence building up in this way of life. So this is what the past tense of the past history of the viruses which you need to understand. And what is the current or the future of the viruses? Viruses still evolve, which means that the viruses is multiplying. The variations of the viruses is seen. Unless and until we containment means unless and until we stop the chain of transmission, you will not be able to come out of this COVID-19 pandemic. The term pandemic itself means that it is present throughout the world. Pandemic means present in a large area, large geographical area across boundaries. That is called as pandemic. So if you want to stop this pandemic, you need to understand how the virus circulates, what are the disease condition which is caused, and what is in your hands to prevent or stop this virus circulation, and what do you mean by silent circulation. All these things has to be seen. But one thing true about the future is the virus still evolves, which means that the virus persists and the virus is changing its shape or its characteristics in every now and then. That is how we have got this lambda, kappa, delta variants which has been coming into various parts of the world. Now let us see about there are many questions which has come up in recent times. about the containment of the viruses. As I said, to stop the virus, we need to have containment. Okay, very small common questions before entering even into the subject of transmission. We need to know some common questions. Who should not wear mask? It is universal that everyone has to wear a mask. I am not wearing a mask because I am sitting in an isolated room. If you are sitting along with your friends in a common laboratory or in a common room, please wear a mask. Mask is an absolute necessity for stopping the transmission. So the question is, everyone has to wear a mask, but who should not wear a mask? Well, young children under age of 2 need not wear a mask. Trouble in breathing. Those cases who have been asthma or any other congenital respiratory illness is there, those people who are TB cases, those people do not need to wear a mask. Those guys who have become unconscious in road accidents or in any other cases like in heart attack or anything, they do not need to wear a mask. Incapacitated or unable are the guys who without an assistance cannot remove or put a mask, do not need to wear a mask. These are the conditions of the people who whom there is an exemption for not wearing a mask. All other guys, whether they are young, whether they are elderly, whether they are exercising, whether they are doing healthy, have or need to wear a mask. Mask is an absolute necessity. Now coming back, I'm wearing a mask. That doesn't mean that it is a substitute for social distancing of 6 feet between you and your friend. You are wearing a face mask or a cloth mask. Cloth mask is not a substitute for social gathering. Many people think that, like, I'm wearing a mask, I am vaccinated, I can have or I can attend a function. No, that is absolutely bullshit and nonsense. Even if you are vaccinated, even if you are wearing a mask, you should not do a social gathering. And even if you are supposed to be in a social gathering, you have to have a 6 feet distance between you and your friend. So the take home message is, cloth face mask is not a substitute for social distancing of 6 feet. You have to have the social distancing. Then the second and the next question in the present day, these are something which we are discussing in the present topic. Some people are asking, fully vaccinated. Are you fully vaccinated? I am partially vaccinated. I have got first dose. I have got second dose. I am fully vaccinated. Some people say that even after getting vaccination, I am having COVID-19 or I am positive for coronavirus. What does all these mean? This is the second question. If you just Google it, you will be getting 100,000 answers for this. But the correct answer is, whether you are vaccinated or not vaccinated, to maximize the protection from the new variants like Delta, you need to wear a mask. Unless and until the zero cases, the cases comes to zero, you need to wear a mask. Okay. When I am fully vaccinated, when I am called fully vaccinated, yes, when are you called fully vaccinated is very simple. After 2 weeks to 3 weeks of the second dose in a series of 2 dose vaccines. For example, Covishield or Covaxin, they are having 2 doses. When you have completed the second dose, and from the date of the second dose, 2 to 3 weeks it has to go for you to say that you are completely vaccinated. Or in case you are getting only single dose vaccination like Johnson and Johnson, it is 2 to 3 weeks after the first dose of the vaccination. So post vaccination, you need to give the time for your body to generate immune response, and that is that 2 weeks or 3 weeks, and then only you are called as fully vaccinated or completed vaccinated. If you are unable to vaccinate yourself due to non-availability of vaccine, or you are having pre-existing condition, or like you are afraid of vaccination immediately, or your choice of vaccine is not available in your place, then follow the precautions. That is the only way. Follow the universal precautions of distancing, hand washing, and wearing a mask. Avoid outside or crowded places. Keep your home ventilated. Okay, well, once this is another question which has been raised in this in many platforms. Basically, the many people are asking us, well, I am a high risk group, I belong to a high risk group. When I was doing my education, high risk group is the guys who are in medical fraternity. For example, a doctor, a lab technician, a dentist, a nurse, we are called as high risk group people because we have been closely associated with the patients or infected ones. But currently in the pandemic, a high risk group means who are supposedly working in an office or working in a shop where they are meeting multiple people, or they are looking into, or they are collaborating, or they are collaborating with multiple people. They are high risk group. Okay, I am fully vaccinated and I am working in a high risk group. If I find that one of my colleague or one of the areas where I have gone, one guy has got positive, immediately what should I do? Even if I am exposed, what should I do? That is the questions which is usually asked. Very simple. Test in 3 to 5 days. Don't be panic. Nothing to be panic. If you are vaccinated, nothing to be panic, but still you have to test yourself in 3 to 5 days. No symptoms, well and good, still test. Because currently coronavirus variants are not causing any symptoms. They are from zero symptoms to full of symptoms. So we don't know whether you are healthy. You can be a carrier without knowledge of yourself. You could be transmitting the virus into your nearby family members, your sons, daughters, or your elders. All things can happen. So whether there is a symptom or non-symptom, whether you are vaccinated or a non-vaccinated individual, in 3 to 5 days you need to test yourself. Wear a mask for 14 days. Universal precaution. If you have been known to be positive, then isolate yourself for 10 days. And if you require medical assistance, seek medical assistance. And remember that precautions are always protective. Precautions are always protective. And then I have been talking from the first day, from the first slide, I have been saying about the variants which have been observed. The virus can variate itself. Of course, in current scenario, Delta variant, which is highly pathogenic and more fast, it is the spread, the nature of spread of the Delta variant is comparatively higher than the classical one. Even though if I am vaccinated, I could be infected by Delta variant, but the number of people infected by Delta variant in vaccinated group is very small compared to the non-vaccinated individual. So non-vaccinated individuals are high risk to the Delta variants, whereas few of the vaccinated individuals after vaccination, very few can get Delta variant infection. Those with immune system, or like those guys who are under immunosuppressive doses because of cancer treatment or any other treatment, where the vaccine doesn't give them enough immunity or protection, they can be infected with the Delta variant. And universal precautions is common. Again, I'm saying that though vaccines are very safe and they are very effective, in the way how they are effective, they can, in many of the individuals, they can prevent the virus infection, but in some of the individuals who are high risk or repeatedly exposed to the viruses can get the Delta variant, but the severity of the disease is very minimal. Whereas in non-vaccinated, the severity may be minimal to very high, even it may reach the fatality. So you need to understand that vaccination is a good protection source for even for the variants which is coming up in recent days. Eventually vaccinated, what is the other take home message? The negative side of the vaccinated is, even though if you are vaccinated, you could be exposed to Delta variant and that you can transmit to others. So that is the reason I said always try to protect yourself with the mask and use hand sanitizers. Though you are vaccinated, though you are not vaccinated, universal precaution is a must. This is required to break the transmission cycle of the virus. So once you think that you are vaccinated, you are fully protected, doesn't mean that you can go and do whatever you want, but you have to take universal precautions though you are vaccinated. That is the take home message from this slide. Now coming back to one thing, it's a very small, I have been telling about variants, but how these variants are causing. It is a 1 minute video to make you more interesting. Just see, it simply says that the genomic structure or the DNA or the RNA of the virus is like it is copied. Each time it is copied. It is not like a common Xerox copier what you see. The Xerox copier doesn't make mistake, but here the copying can make mistakes. It can edit some parts. This edited part might result in no reaction, mild reaction, or it may become more pathogenic like what we see in Delta variants. How does this occur? If you are allowing to copy, where does it copy? It copies in human cells. So when the transmission is from one patient to another patient, the copying of the virus happens. When the patient to patient copying is happening, depending upon the individual's immune system, there can be genome editing, or there can be mutation occurring. This mutation will result in variant. That variant might be pathogenic, and that may infect more people. That is how you are getting the variants. Very simple way, normal way, and commoner can understand what is variant. It is not a rocket science to understand or need a science background to understand. It is like a Xerox copier. Xerox copier does the work, but here you need to have a editing machine to just do that. Then what will happen if you are not going to stop? The variant story I told already. Now I'm just going to tell what will happen if you are not going to stop the spread. This is also a small video, educational video, which has been let out by World Health Organization. Very clearly, if you are not going to stop the virus circulation, we are going to get new more variants. Delta is now, Kappa is there, like that way Lambda is there, Iota is there. So many Greek letters are there, and all the Greek letters there will be one variant, and which may be able to cause the disease or new type of disease. And that is the reason you need to cut. And how to cut? Getting vaccinated. The first point is getting vaccinated. The second point is washing your hands frequently. Third one is wearing a face mask, and fourth one is social distancing. This is the only way currently it is available for prevention. Okay. Now coming to the third part, this is also a very small video for you. This video is very simple. What happens is, for example, I am there in Madurai, or I am in Chennai, and in Madurai, you people are there in Madurai, and you are saying that I don't have any case. We have all been vaccinated and I don't have any case, so I can go out and do whatever I like. But nearby Trichy and Madras has huge number of cases. What will happen? Your place is well protected, you think that, and we are not protected. It is not the condition like that. Very simple. The emergence of new variants from our side will start infecting the unknown or the areas where there is no infection, and you will be getting the second. Even though when we are going in the first wave, you will be getting the second wave. And that is how the second wave has come. The take-home message from this slide is very simple. Tamil Nadu, for example, just vaccinating all the individuals from Tamil Nadu doesn't prevent the coronavirus. Andhra Pradesh also has to have zero coronavirus. Karnataka has to have. Maharashtra has to have. Likewise, Kerala also has to have zero coronavirus infection. How can that be achieved? Universal vaccination. Now, this is about our country. When we talk about global scenario, doesn't that mean that India alone is fully vaccinated? Once India is fully vaccinated, zero case in India, does it mean that we are safe? No. It can come from Bangladesh, Pakistan, Nepal. So we need to take care that even Bangladesh, Nepal, global vaccination initiative has to be there in order to stop the circulation of this virus. Now, the most interesting part which we are going to see is the future, or in the current area, some of the questions which are wrongly inferred. Many questions are there. Recently, I was asked that, does 5G transmit coronavirus? Radiations, 5G phone. Does 5G, they were asking whether the Chinese government is leaving 5G. Will 5G transmit coronavirus? No. There is no, it cannot. Radiation, the virus will not survive in radiation, so the 5G cannot transmit coronavirus. Some people have asked me, COVID-19 can be transmitted through the goods which we are getting from the prevalent countries, or those countries which has a very high number of coronavirus? No. Because from that country to come, transportation from that country to this country, the climatic conditions will be changing. It will be harsh weather. Though the virus can live on fomites for a few days, the virulence of the virus will get lost, and that is the reason you will not be able. The infection will not be that high or good, so you can always get the products from other countries. Can COVID be transmitted through mosquitoes, houseflies, cockroaches? No. There is no recorded history, or there is no scientific proof that the COVID-19 can be transmitted through mosquitoes, houseflies, or through birds, etc. How can we be sure that the COVID is not transmitted through our clothes? Very simple. Don't wear the clothes many times when you are going outside. Just wash the clothes with soap and detergent. This will prevent the coronavirus infection. Can drinking alcohol prevent COVID-19? This is the universal question. Very high number of people have asked this question. Can drinking alcohol help to prevent COVID-19? Definitely, drinking alcohol will aggravate the infection if he has. Drinking alcohol will never be a solution, or it doesn't prevent COVID-19. If you are taking up alcohol, it will complicate your COVID-19 status, and you will be one step nearer to the death. So drinking alcohol is not an answer. When COVID-19 can be transmitted in cold weather, some people have asked, I'm in a sunny country, I'm in hot place, so I can go out because the sun rays will kill the COVID-19 virus. These are some of the myths. Whether it is cold or hot climates, COVID-19 can be transmitted. And in many places, next question is, you are using digital thermometer. Can it detect COVID-19? Basically, it is only a surveillance. What is the surveillance? Some of the COVID-19 cases can have low-grade fever. So if the people who are coming inside a mall or a shop, if they have a low-grade fever, then you can definitely stop them or isolate. But it is not a 100% foolproof method. Can we use a UV lamp to disinfect our bodies? Definitely no. Don't use it. You will be infecting, or you will be getting radiation injuries. Spraying alcohol or chlorine on yourself and cloths will prevent you? No. That will only damage your cloth and your skin. Nothing else will be done. Can eating garlic will prevent COVID-19? Some people say pepper, chicken soup, and garlic will prevent COVID-19. No. There is no scientific evidence that these all will prevent. Though it has some antibacterial efficacies, anti-inflammatory actions of garlic and pepper have been proved, it is not an antiviral, or it is not specifically inhibiting COVID-19. Pneumonia vaccine, can it prevent COVID-19? No. Pneumonia is a bacterial infection, it cannot prevent. Antibiotics, likewise, it is not against COVID-19, but because of COVID-19, there can be some bacterial infections. In order to reduce the complications only, the antibiotics have been given. But actually, antibiotic itself cannot prevent COVID-19, or it cannot treat COVID-19. Rinsing the nose with saline, salt water, can it prevent? No. Usually, rinsing the nose with salt water can reduce the cold. Common cold, it can be a remedy for the common cold, but not for COVID-19. Is there any drug to prevent COVID-19? Yes, there are few drugs are there, like remdesivir is there, but depending upon the individual conditions. We have favipiravir is there. We have remdesivir is there. We have other monoclonal antibodies as well as anti-inflammatory agents are there, which could be given in a particular case. We have to go case to case depending upon the pathology and depending upon the severity of the pneumonia. These drugs can be given, but there is no universal drug as such that can immediately, like common cold or fever, you are just putting a paracetamol and getting it cured. Nothing such drugs are currently available. Only available thing is vaccine, so better adhere to the vaccine. We will finish. Last few things are there. Some possible clarification, some more possible clarification. Who could get vaccines? Everyone of 12 years of age and older is recommended to get COVID-19. In India, currently, it is not like that, but very fast, the government, once the elderly people and the young people have been vaccinated, the vaccine will be open to the children, that is pre-teens and teens of 12 years of age to get vaccinated. So vaccine can be given to all. Vaccination is the important public health action to to end the COVID-19 pandemic. Please note, this is the final ending point which you need to take out from the entire talk. Vaccination is the most important public health action to end the COVID-19 pandemic. We don't have any other way to end this currently. So as of July 27th, CDC recommends everyone to get vaccine. You should be vaccinated even if you are already having COVID-19 infection. That is absolutely true. Even if you have passed COVID-19 infection and you have been hospitalized and treated, you need to get after 90 days, you can get COVID vaccination. It is definitely a must for everyone. So the myth, these are all some of the myth which you need to understand. I have already got COVID-19. I have suffered COVID-19. So natural protection might be there. So no need for vaccine. No, it is not true. After a particular time period, the antibodies will come down. So you have to have a vaccination as a booster dose, definitely. Can pregnant ladies get vaccinated? Yes, of course. Pregnant ladies can get vaccinated, has to get vaccinated, because complication of COVID in pregnancy is more horrible, where stillborn child or mentally retarded childs can be born. So generally, it is recommended that the pregnant ladies can get vaccinated. Does feeding mothers can be vaccinated? Yes, the vaccine is very safe. The data says that though there is no clinical evidence or like study which has been done for lactating mothers or breastfeeding mothers, the past history of vaccines say that it is safe for uh, uh, lactating mothers to get COVID-19 vaccination, which means that there is no um, mother's milk doesn't contain any viral particles or antibodies. And some more possible clarification is very important point which you need to understand is, I have not gone out. Nothing has been done. I'm having a universal precaution, but still my parents have gone positive. My relatives have got positive. Where does it come? Silent transmission. We call it as children's, preteens, and teens. They are not. Though they get COVID-19, their symptoms are not very severe. It may be looking like a common cold. So you may be just treating them and everything will be normal. But unknowingly or knowingly, they will be transmitting the virus to the healthy individuals or elders in the home. They will be just transmitting the viruses, and those people who are vulnerable, pre-existing conditions like diabetes, hypertension, those people who are alcoholic, who smoke, everyone can be easily transmitting, getting this virus, though they don't go out of the home, from their own children who go out for playing or nearby shops, etc. That can happen. So the COVID can be transmitted through children to older adults, people with the cancer, immunosuppression, chronic kidney disease, type 1 diabetes, lung disease, or chronic smokers, heart conditions, atherosclerosis, liver conditions like hepatitis B or hepatitis C, or chronic alcoholic drinkers, HIV, or congenital immune diseases. All these people can get COVID from children itself, who are who will be healthy, who will be looking healthy without any symptoms, but they will be silently transmitting. That is the reason universal precaution, hand washing, face mask, and social distancing is usually observed or has to be severely adhered in all the people. The last part of the talk is, some people recently asked me, in the current scenario, uh, I'm going to get vaccinated. Shall I take this? Should I need a special diet? No, nothing like that. There is no study or there is no scientific data stating that to get vaccinated or your vaccine works with good amount of food or different types of food. Nothing like that. These are all myth. You can take normal food, that's it, and you can get vaccinated. And some people have asked me side effects. I get headache, I am very tired, I get fever, and some people say that I don't have any of these symptoms. So they are now confused. If the people who are getting the side effects, they say that because I have got fever and headache and other things, my vaccine works. And the people who think that I did not have any symptoms like headache or fever or like body pain after getting vaccination, does it mean that my vaccine is not working? No. Side effects are person to person dependent. Like it is individually a person's physiological makeup at the time of vaccination determines whether he will get fever or tiredness, etc. If you are very healthy, you may not get anything. So it is a person to person concept. It doesn't mean a vaccine, for working a vaccine, it doesn't mean that it has to produce a side effect. Whether it produces a side effect or not producing a side effect, the vaccine will work and give maximum protection. So it is all myth. Whether you get fever or you don't get fever, the vaccine is going to work in your body. Got it? That is. With this, I come to this end. Now we have seen the past. The present. We have discussed very high present topics have been discussed in the present. And as far as the future is concerned, if you adhere to the present things like precautionary measures as well as vaccination, you can cut the chain of the virus transmission in the future, so that there won't be a third wave or fourth wave or fifth wave. So for the future, the only thing is be safe from coronavirus infection. That is the current thing. Be smart and inform yourself about it. This is for the present condition. Be kind and support one another is for future. So safe, smart, and kindness is the mantra for understanding the past, present, and future of the COVID-19 situation. So inform yourself better, as well as be kind to others, and wear a face mask, social distance yourself 6 feet, and then get vaccinated. And please tell others to get vaccinated so that we can end this pandemic very fastly. Otherwise, we are going to face more tough
Question
times.
session, Kusataya.
With this, I come to the end, and if you have any doubts or if you have any questions, the forum is open for discussion.
Thank you, sir. Thank you for a wonderful speech. Students, do you have any questions to ask to the chief guest? Students, even you can ask in Tamil. The chief guest, he knows very well in Tamil and also English.
Dr. N.M. Mekala, Assistant Professor of Commerce, Sorosha College. Actually, I didn't take vaccine. Is it compulsory to take vaccine, sir?
It is, if I ask me, I will say that it is compulsory to take vaccine. Why? Because
Okay.
you are in high risk group. You are in a high risk behavior group, which means that like when you are going out and others, comparatively, you will be more susceptible to the virus. You can get more virus infection than the vaccinated individual. So you are more risk. You are at more risk. So I would suggest that you have to take the vaccine of your choice, whether it may be Covishield or Covaxin or Pfizer. Please take the vaccine and be safe.
Okay, thank you, sir. Actually, I have a panic that when I have cold, if I take vaccine, it affects me a lot. I feel that is why I am not taking. Is it necessary to check and take vaccine, sir?
If you have a high fever and other things, then only it is not advisable to take a vaccine, because your immune system might not be that much working towards this. If it is a common cold and other things, yes, you can definitely take this vaccine. It is nothing to do with that.
Okay.
And
Thank you, sir.
as soon as possible, please take the vaccine.
Thank you, sir. Thank you, sir. I'll try, sir. I'll try. Thank you, sir.
Yeah.
Students, do you want any questions to be asked to the chief guest? Can you even ask in Tamil?
Good afternoon, sir. I'm Kavita, Assistant Professor at the Department of Commerce. I have a question for you. My husband was affected by corona. Still, he has not kept any vaccination. They said that after 3 months, they have to take the vaccination. What is the correct time?
90
What is the
days.
correct period?
90 days is the correct time.
After 90 days, he can be
Yeah, he has
vaccinated.
to take the vaccine. Yes.
Okay.
If, for example, some people are there, if they would have got coronavirus last year, in the last year, the first wave, maybe in last June or July or September. In that case, they can take only one dose and leave it. Like it can be the second dose. But now, in the current Delta variant condition and other things, uh, if your husband has crossed the 90 days, please book a vaccine for him and let him take the second dose and third dose, which we call
Which
it
one
the
is
second
better,
dose.
sir? Which vaccination, whether it is
This is a
Covishield or Covaxin, or which one is better to
Well, that
even
is a
fight?
very tricky question, and I'm in a very public, open forum. I don't advocate for any vaccines. Actually, I should not advocate for any vaccine, but both the vaccines are good. For example, I will tell my experience. I have taken Pfizer. My mother has taken Covishield. My wife has taken Covaxin. So I don't have any preferences. Whichever is available, first try to safeguard you. The first foremost thing is get vaccinated.
Okay. Thank you, sir. Thank you.
Sir, once again, the question, suppose if we have taken Covaxin, the second dose, if we take Covishield, will it affect?
No, they like that. They cannot put. Actually, they don't put such vaccines. You cannot cross vaccines because each vaccine has a different mode of action. For example, the Covishield is an mRNA vaccine.
Okay, sir.
mRNA vaccine is like if you need to tell in தமிழ் தமிழ்ல சொல்லணும்னா கோவாக்சின் வந்துட்டு ஏற்கனவே சமைக்கப்பட்ட உணவு. அது தந்ததுன்னா அது செல் தானாவே எடுத்துட்டு வேலை செய்ய ஆரம்பிச்சிடும். பாதி சமைக்கப்பட்ட உணவு. கோவாக்சின், கோவிஷீல்டு இது. கோவாக்சின் வந்துட்டு இட் இஸ் அ டெட் வைரஸ், அட்டனுவேட்டட் வைரஸ். அது அந்த அந்த வைரஸை கொடுத்தோம்னா நம்ம செல் தான் நம்மளாதான் அது சமைச்சுக்கும். நம்ம செல்லே தான் அது சமைக்கணும். ஸோ ரெண்டுமே வேற வேற பாத்வே. ரெண்டுமே இட் ஹாஸ் அ டிஃப்ரெண்ட் mode of actions, so you cannot cross the viruses. Whereas for example, இதே வந்து கோவிஷீல்டு அண்ட் மொடேனா அப்படின்னு ஒரு வைரஸ் வெளிநாட்டு ஒரு வேக்சின் இருக்கு. அந்த மாதிரி ஒரே டைப் ஆஃப் வைரஸஸ் வேணா, ஒரே டைப் ஆஃப் வேக்சின்ஸ் வேணா மாத்தி கொடுக்க ஒரு ரெண்டு சான்சஸ் we have கேள்விப்பட்டிருக்கோம். பட் யாரும் பிராக்டிஸ் பண்றது இல்ல. we don't practice, but it is always better to get Covaxin first dose, Covaxin second dose, Covishield first dose, or Covishield second dose. That is the usual method.
Okay. Thank you, sir. Thank you very much.
Students, I'm waiting from your side to ask any questions. Do you have any questions to ask? Okay, then I think our students are very much hesitated or very much feeling shy to ask questions. I think hopefully in the next webinar you will be coming forward to ask. So we have come to the last part of this webinar. Now I request my colleague Dr. S.S. Suganti to give the Thanksgiving note. Welcome, ma'am.
Thank you, madam. I, Dr. S. Shuyanti, Assistant Professor of Commerce, Sarusha College, Madurai, is taking privilege to propose vote of thanks. I take this opportunity. I thank our beloved Secretary and Correspondent, Dr. D.R. Kumaris, for his entire support to conduct this international webinar. Thank you, sir. It is my pleasure to thank our President, Treasurer, Managing Committee members for their help to conduct this webinar. I thank Professor N.H. Saravanan, Principal in Charge, Saurasha College, for extending his cooperation to conduct this seminar. I am double happy and my heartfelt thanks to our eminent resource person, Dr. Harish C. Chandramoorthy, Vice Chairman, Associate Professor, Saudi Arabia, for the wonderful and valuable speech which is inspiring and useful to us. Thank you very much, sir. I thank our head and faculty members of my Department of Commerce, faculties from various disciplines, and students, participants. Thank you, one and all. Thank you, sir.
Students, before closing the meet, I ask everybody to please turn on your video so that we can have a screenshot. Please, everybody turn on your video. We can have a screenshot. Please turn on your video, everybody. We can have a screenshot and then we can wind up the session.
I think my camera is not working or something happened.
Sir, Harish sir, please turn on your video, sir.
Yeah, I'm just trying actually. Something has
Okay.
happened.
Okay.
I'm just trying to. Is it now visible? No.
No, sir. No. Students, please, everybody, please turn on your video. Few have not opened it.
Is it now visible?
No, sir.
Okay. Let me just. I don't know. Something.
Register number 002 141 155 018 012 153 Shivashri 018. Please turn on your videos. We will have a screenshot and then you can go off. One 53. Students, please give your feedback link, which is provided in the chat box. After filling your feedback, you will be getting the certificate automatically in your mailbox. Is it clear? Feedback link.
Clear, ma'am.
Okay. Okay. Thank. Chandramoorthy. Dr. Harish?
Yeah, I'm not able to. Uh, is it now visible? No.
No, sir.
I don't know. It
I
is
think
showing
you're
that-
having some problem with your
yeah.
video cam.
Yeah. I have given the permission, but it is auto turning off. Can you see me now? Am I visible?
Yes, sir. Now it's visible.
Yeah.
Thank you all. We have taken a nice photo. Once again, my heartfelt thanks for the chief guest and also my faculty members and my students for joining in this session. Hopefully, thanks a lot. Thank you, sir.
Thank you. Thank you very much. Yeah.
Thank you all.